Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm very excited and honored that you're here. Today, we have a great guest with us, Dr. William Levine. He's a board certified periodontist with over 35 years of experience and an expert in oral inflammation. Dr. Levine has a private dental practice that specializes in periodontal disease and implantology. He's also chief scientist at PeriActive Oral Rinse and founder of Izun Pharmaceutical Corp. He spent the last 15 years researching specific plant bioactives that naturally reduce inflammation so he could help his patients, and probably yours, prevent and manage gum disease. Welcome to the podcast.
Thank you, Brian, and thank you for inviting me.
Of course. You are a specialist in one of the areas that I think general dentists like myself probably don't have as much knowledge, I would think, than other areas, which is periodontal disease. And so, could you talk a little bit about your perspective on the state of periodontal disease and how we can help our patients?
Sure. I think that for some reason or another, you're correct in that fact that a lot of dentists are uncomfortable with periodontal disease and periodontal treatment, and yet in some ways it's so easy. And I think part of the conversation I'd like to convey today is it really is easy, and you guys can all do this. Basically, the way we have to think about periodontal disease is, and I think our thinking has changed. It used to be that we were taught that it's an infection, and the infection caused bone destruction around the teeth, and that it was a difficult thing to control because the mouth always is somewhat septic. So, how do you control that kind of problem? And the disease will generally be progressive. In reality, what we have is not a infectious disease, but an autoimmune disease or an inflammatory disease, in the sense that the infection sparks an inflammatory reaction. And that's a good thing because our bodies are designed to protect itself. Inflammation is positive. If that inflammation keeps getting stimulated by more and more plaque or different traumas or whatever it is that's affecting it, and that's not stopping, it's basically our systems go into overdrive trying to manage it, our protective systems. And when it hits that point, the inflammatory reaction or our defense system becomes ineffective. And not only does it become ineffective, but as part of its normal process, it's spewing out enzymatic materials and different cytokines and opening up vascular channels and causing local destruction to fight the infection. So that's what causes bone disease. It's an infection stimulated inflammatory reaction, which is dysregulated or chronic or not functioning properly as a protective mechanism. So, in a sense, our bodies are destroying themselves. Now, as that disease gets further under the gum, we actually have less access to it, and our patients have less access to it. And that's where the difficulties lie. So, I think what we need to do, number one, is understand the disease that we have to both debride or clean out that infection, but also we have to stabilize the patient's inflammatory response so that we can make sure that it continues to function normally. Okay, because now it's actually hyperexcitable. Anytime you put a little plaque in there, it'll zoom from 0 to 100 and start destroying tissue again. We need to reset that. So those are our goals. So from a dentist standpoint, you see a patient with gingivitis or periodontitis, get them into your hygienist, but don't stop there because the hygienist is not capable of seeing the combination of the inflammation and the infection, and the dentist is. Dentist can read tissue. He looks at that tissue and he knows it's inflamed. You need to have either yourself or somebody is trained for that go deeper under the gums and make sure they completely debride out that area. That will get a certain amount of reset of the inflammatory reaction as well. But there's other things that we can do. I just want to let the conversation flow so we can make sure we target all the right areas. But it's easy to do. Don't be frightened. And it's just get onto the gums and clean them out. Okay.
So let me just rephrase, and I've got a question for you. Like the fact that debridement, cleaning out the area is obviously crucial to get rid of a lot of the infection. But what you're saying is that this is an inflammatory response. I'm thinking of a fever, right? A fever is a good thing because you kill off bacteria that are causing some type of inflammatory reaction. But if it gets out of control, we take medication to reset that and calm things down. Is that a little bit like what you're talking about?
Little bit, yes. So let me drive down a little bit deeper. In other words, you're right. If we can't get rid of all the bacteria, then we should use alternative methods like antibiotics, and that will help.
Mhm.
But again, since the area is an environment under the gums, which has already suffered from bone destruction, and it's a warm and cuddly environment for pathogenic bacteria, we've got a problem because they're going to recur and repopulate. So we need to really reset the inflammatory reaction. I'll explain to you where I'm going, because for me, this was an aha moment in my career where I got much more involved in research and development because there's a lot of refractory periodontal disease, which is why a lot of dentists have given up and said we can't really control it. It's not true. We can control it, but there is still a significant amount of refractory disease. About 25% of cases that are well treated and well maintained will have isolated areas of recurrent disease. That's too much. That's 25% of our well treated patients. Imagine our non well treated patients. So the way we do this in our practice is twofold. Number one, we have to increase the efficacy of our subgingival debridement. And this is something that in our office, we spend a lot of time with root planing. We also spend a lot of time with subgingival laser therapy. We use different lasers, either diodes or erbium lasers for different purposes, but we get a very thorough debridement. And actually, we're able to control a lot of periodontal disease like that. But again, once you've had periodontal disease, you now have a predilection for it. You have susceptibility for it. And like I said earlier, once you start getting a little bit of an infection, you'll go into a hyperexcitable state and have destruction taking place. One morning, I'm looking at myself in the mirror and I say, what can I do to change this? And the thing is that since we have a system where we can't see the patient daily and we don't want to see the patient daily, and the patient certainly does not want to see us daily, and we need to develop a home care system where this patient can manage his disease more effectively so that when he comes to see you on those maintenance visits, he's actually relatively healthy. So if we, like I said earlier, we need to control that inflammatory response. But if you look at the world of anti-inflammatory drugs, they're basically divides very clearly into two classes: steroids and non-steroids. The non-steroids are all the classic anti-inflammatory drugs, the ibuprofens, the naproxens, etc. And the steroids are a myriad of different topical materials or systemic materials. The problem is that in the mouth, we don't really want to give not systemic anti-inflammatories or systemic steroids. We want to do something topically where the patient doesn't have to take a drug that goes through his entire blood system to reach his mouth. We can deliver right into the mucosa of the tissue. So we needed something that was safe and not contraindicated for long-term use. So I come from a dental school, medical school background. I don't come from the natural products background, but inside the world of natural products, there are a lot of bioactive and pharmacologically active compounds which we have to become aware of because they're safe and easy to use. And so we spent years breaking down different botanical materials, looking for how they were working, how they were affecting the body, what precisely is active. Because remember, this is a natural product. Every year it's slightly different. We have to be able to control that process. And then what would work well together. So after a long period of research, we came up with a combination of three botanical materials: Sambucus nigra, which actually people drink as elderberry; Echinacea purpurea, which is it's a very well-known supplement used often for immune boosting, although we've found different physiologic activities for it; and something called Centella asiatica, which is very well known in Europe and very safe. And we have developed proprietary extraction systems which optimize the active agents within it to go penetrate through the gum tissue, basically downregulate the immune response, which is really cascade. It's not one event, it's a waterfall of different events: cellular, vascular, enzymatic, which you need to control each of them a lot, not shut it off, just downregulate it. And equally important, upregulate the healing mechanism. So when you're finished with that, you killed the bacteria because it is antibacterial. You've shut down or work down the anti-inflammatory response. You've upregulated the healing response, so your tissue is thicker, more dense. The collagen is forming, the vascular patterns are reorganizing, and all this happens from an interaction of those compounds in this mouth rinse. And you basically get a healthy patient and a stable patient. So what ends up happening is we're able to reset the inflammatory response regardless of how good your home care is. In fact, we did a trial where we stopped having patients brush. No brushing, let the plaque build up for a period of 10 days. And not only did the inflammation not develop with the periactive rinse, it actually slightly improved despite the plaque buildup. Now, we don't recommend that, but you're right. What we needed to do was, yes, debridement is critical. You need to get rid of the bacteria that's pushing this inflammatory response, but you also need to reset the inflammatory response so you can work yourself back to a normal state. And when we do those two things, our patients come back healthy. And actually, surprisingly, the patients feel the difference. So the rinse is called PeriActive. It's a game changer. And I'll tell you, it was so powerful in its use in the mouth that actually there developed subsequent to that a wound care product, which is FDA approved for chronic wounds. And we are testing it now, looking at cancer patients to try to prevent oral lesions in their mouth with very good success. So, point is, it works, and it works on periodontal disease. And in a sense, through that process is where I developed my expertise in oral inflammation. I don't want to keep, I feel like I fire hose the audience, and I apologize, but it's not hard to treat, and it should be part of your regimen.
No, everything that you said, I think, is valuable information. That's why I didn't interrupt you. I think it's great. I think the quote that I would always tell periodontal patients in my office, which my only source is my periodontal instructor in dental school. And he said that 70% of treating periodontal disease is home care, right? Now, I have no idea if there's research behind that or if that was just a number that he threw out. But I has told every periodontal patient since I got out of dental school for the last 25 years that statistic, try to encourage them with their home care. Because, like you said, periodontal patient is someone who has periodontal disease is going to be more susceptible to periodontal disease in the future. And so I'm just going to recap. What you're proposing is not that dentists really change what they're doing from an active therapy perspective, unless they need help with debridement. It's more helping the patient with the home care by using periactive, which gets control of the inflammatory response.
And the
And it
bacteria,
sounds
and the
like
bacteria.
this.
You're right.
So this is a rinse. What's the instructions for the patient's usage of the
So
rinse?
it's the rinse is called periactive. It comes in a month's dose of a bottle of 500 mil, 16 ounces, and we use it twice a day because you need to make sure that compliance is high. If you ask someone to rinse 3 times a day, you're only going to get twice a day anyway. And you rinse for 1 minute, and don't eat, drink, or rinse out for an additional 30 minutes after that, because the material will stay in your mouth. And I'll just share with you an interesting fact. One of our patients who were using it asked, "What about substantivity?" Right? Because we're all taught about substantivity. Chlorhexidine has wonderful substantivity. And I said, "You've missed the point. Substantivity is good to measure something that stays in the mouth. We don't want this to stay in the mouth. We want it to go into the tissue. If it has a high substantivity, it's not where it belongs. It needs to get into your gums and really make a physiologic difference." Yes, killing bacteria is critical. I love what your instructor said about 70%, because think about it. Your patient is seeing himself every day. You're only seeing him once every 3 to 4 months if he's compliant.
So the statistic is actually useful, which is great because I've been using it for the last 25 years. So is this available over the counter? And how long has it been available? Or is it available through dental practices exclusively?
So it was originally available through dental practices exclusively until this year. We recently made it available to both the dental practices online as at a special price, obviously, but and to the patients directly as well. We usually sell it at 2 bottles and ship it, directly to the patient or directly to the dental office by the case. Okay.
Great. And how long has it been? Have you been selling it?
I'm actually, although I have a very Native American accent, I grew up in New York, but I've been living abroad now. So it's been launched in Israel about 7, 8 years now, with excellent results. And then we launched in America probably around a year ago, and it's been really doing very well. Since I'm a northeastern, that was my Easterner, that was my sort of home ground, and that's where most of our docs are using it. But it's actually been spreading now. We moved our distribution center out to Kansas because we needed to be more central. So
Oh, that's great. Well, uh, It's very exciting. I know we all know the statistics that about a third of the adults in the US have some form of periodontal disease. And of those who are actively treated, it sounds like about a quarter of them, maybe a little less than a quarter, relapse. If our job as oral health professionals is to elevate the oral health of our patients, right? This is you're doing great work in addressing a large percentage of the population that need help. So thank you, Dr. Levine, for all you do, and thank you for being on the podcast.
My pleasure. And your podcast is a very impressive podcast. And thank you for thinking of the patient first. It's an important
Of course.
concept.
So where can people go to find more information about PeriActive?
It's on a website called www.getperiactive.com, and it's available. There's plenty of
Great.
literature on this. We've published about 16 articles, and it's there. I
So
strongly recommend it.
just go to Peri, active,
Yes,
getperiactive.com. Right?
correct.
Awesome. Thank you again. Appreciate it.